I squeal in the night because it's like someone's sticking a probe in my leg. It's absolutely bizarre, and I've had it for months.
So you must be very pleased you're pregnant and also
No, I'm
quite worried.
absolutely terrified.
Are you terrified?
Absolutely terrified.
Sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
You know, just thoughts about ending it all and how I do it.
I know it's a nuisance when you're there, but it's just delayed things for you anyway, hasn't it?
The thing is, I'm absolutely furious.
Away. That was even bigger.
Seriously?
Have a look.
Oh my goodness! Oh my god!
Good morning, Alicia speaking. How can I help? Hi, Jackie. Hi, come on in. How are you?
I'm good, thanks. And you?
Good, fine. I've got Dr. Dillon with me, who's just started with us.
Hi.
So she's just watching at the moment. Right. How are things?
Fine, but it's really daft. But I got a bee sting on Saturday, and it didn't hurt really at the time. But yesterday and today, it's swollen up and it's so sore. So I just went to the pharmacy just to see what can I put on. I've been putting Antisan on it.
Okay.
And I've taken Piriton, but it's just so sore and itchy. But he said, oh, I think it might be infected because it's a bit hot and throbbing. So he said, oh, just see.
So this happened on Saturday?
Saturday.
Yeah. Okay. And I'm just going to squeeze your nails, so it's going to be a bit sore for you. I'm not actually convinced that it's infected.
Oh, good.
It's really difficult with fingers because if you'd kind of got bitten here, it would just swell and it would be able to swell a lot. Whereas with fingers, for some reason, they can only just swell a tiny bit.
Right.
And if they get to a point and they just get too tight, and it gets really sore and throbbing, which is what you're
this is what it's like, but I'm sure that's fine then, do you think?
It is fine. So antihistamines are the right thing to do.
Okay.
The other thing that would be really good is if you can elevate it. So tie your arm up so it's around your shoulder. That would just help gravity to kind of get rid of some of the swelling, and hopefully it would get better. But I don't think it's infected. They're a pain, aren't they?
I know. I mean, I have been stung before, but I can't really remember it. But honestly, even at night, I've been waking up because I've been going on it, and it's so hot and sore. Right, that it?
That's all.
Don't need to do anything. Lovely.
No, fine.
Okay.
Keep doing what you're doing. Yeah.
Lovely. Thanks a lot.
Bye.
Bye.
Oh, and then guess what? When I went home yesterday, I'm like, what's that moving? Them proper ones with a big, long leg spider, thin one, Literally, it was right where I had walked into. So I was like, oh, my God, I just touched that. Nastiness.
Nastiness.
Hello, come through. Please have a seat. I'm so sorry to have kept you waiting so long. I apologise for that. How are you?
I'm all right.
Great.
I don't know if you remember, I had a spine fusion
Fracture.
operation, yes, to sort of fuse the fracture. I don't know whether this is related at all, but since that operation, I've had these weird, they're very difficult to describe, these weird pains all down through my legs.
Frances had originally come to the surgery a number of months after she'd fallen over in the snow. She had significant back pain, and an X-ray actually showed a broken bone in her back. She went on to have an operation to stop the pieces of bone from moving around, as it was thought that that was what was causing her back pain.
The minute I lay down to go to sleep, turn on my side, and then it's like electric shocks just whizzing up and down my legs, all around my knees, hips, ankles. It's really distracting, and sometimes I squeal in the night because it's like someone's sticking a probe in my leg. It's absolutely bizarre, and I've had it for months.
Had you ever had it before the operation?
No.
When did this start?
Well, it's hard to describe because it's kind of crept up. I'm just sitting like waiting for you then. You know, I had sitting like that and like get pains down here and it's weird. But going to bed, I sort of lie there and it's like, okay, it's starting. I can feel it starting. And then they whizzing around, bizarre electric shock type pains.
Electric shocks.
That's sort of what it feels like. They kind of creep up on you and then they go they whiz.
Do you have pain in your back now?
No, the bone pain went immediately as soon as they fused the bones. The muscles have taken ages to heal.
So these pains is it mostly in your right leg or your left leg or both?
Mostly my right leg.
I might ask you to pop your trousers off if that's okay. Jump on the couch and then there's some more blue roll that you can just pop on your lap if that's okay.
Yeah.
And if you give me a shout when you're ready and I'll come through. Great, so I'm just going to check all the nerves in your legs, if that's okay. What I'd like you to do now is push up off the bed with that leg, and now that side, and pull down, and the other side, and bend your knees up for me, and push me away with that leg, push me away, pull me towards you. I'm just going to lift your leg up and rest it on my arm. I want you to go completely relaxed and floppy. Good. Feel free to pop your things on, come and have a seat. Right.
It's weird, isn't it?
It is. I'm not completely sure what the problem is. What I'd like to do is do some blood tests to check some of your vitamins and sugar control and stuff like that, and then see you with the results, and we'll make a plan about what to do. Does that sound okay?
Yeah. But you don't think it's from what they've done on my back? That's what I was more concerned with, that it was...
No, I don't.
You know, okay.
Because the nerves which supply your legs come out much lower down.
Yeah, okay.
Okay.
Right, thanks.
No problem.
Thanks very much.
See you again.
You're making tunes for us?
My neck hurts.
What are we up to?
Apart from being very, very angry, now I went to St George's. I got there 2 o'clock. She looked in both ears, clogged up with wax.
Right.
So she said, you have to see the doctor in order to get syringed.
Right.
3:25, I was rather miffed because I was still sitting there.
So I guess what's happened is you left without your hearing test.
And
you came the other day to get your ear syringed and there was a problem there. And so your ears are still filled with wax and I'm going to need to refer you again to get them sorted out. Is that right? Is that where we're going with the story?
More or less,
Yeah,
yes.
okay,
But
fine.
the thing is, I'm absolutely furious.
I've been a bit worried about my hearing in the last couple of years or so.
Yeah.
I don't catch things that people say and everybody else does.
Partner keeps telling me to get my ears checked because she thinks I'm going deaf. She also talks to me when she's not in the same room and expects me to hear her.
The one on the left, it sounds like roadworks at night.
Oh, really?
As I'm talking now, I feel as if I'm hearing out of this ear, this ear, but not this ear. Very well.
There's a little bit of gunk coming out of his right ear.
Let's have a look at the ears now. So what were you coming to tell me today just about this story? Was there anything new?
Well, actually, I was coming here, hopefully with clean ears, in order to make another referral, because I came to the conclusion that referral you done the last time.
So I've done several referrals for this. I really understand with Ian why he was so frustrated at being kept waiting at his hospital appointment. The problem is that all the clinics and services are really overused and oversubscribed, and so inevitably there are delays in treatment. Sometimes I think people forget that people will get the care that they need, but often it may not be as smooth as they'd hope.
But at the same time, I'm not impressed by these olive oil drips, because every time I put the cotton wool in and take it out just before going to bed, it's just the staining of the oil.
So the reason we get you to use the drops is hopefully it will encourage it to come out, but if not, it softens it, so it will make it a lot less painful for you to have that wax removed. So I know it's a bit of a nuisance having it done, but similarly, it needs to be done for us to get the wax out.
Yeah, I understand that. What I was thinking, though, is like going back to an old and tested method which worked, was getting the olive oil, not the drops, heat it, and then pour it in, and then put in the cotton wool, because the heat from the olive oil going in is going to melt it a lot quicker than cold olive oil.
But it will also damage the skin in the ear. So I wouldn't heat up oil and put it in your ear. I think that would be a disaster.
I'm not saying it's going to be boiling. It's
you'd warm it, but
just warm it.
Yeah, I probably wouldn't do that, Ian. If it were my ears, I definitely wouldn't. Had you just sat there a bit longer at the clinic, you probably would have wax-free ears now. I know it's a nuisance when you're there, but it's just delayed things for you anyway.
I've got other things to do rather than sit around waiting.
I do get that, Ian, but at the same time, you're going to not have your hearing so well for the next couple of months while we get this sorted.
Nothing unusual then, is it?
Okay, right, all done.
Is it? Yeah. Right. I will sort that out.
Okay.
Bye.
Bye.
There's nothing especially wrong, but there is something that's concerning me, and I don't know whether it's something or whether it's nothing or what. But just to give you a bit of background, my best friend was diagnosed with ovarian cancer 2 months ago.
Okay.
And I don't know whether it's just because it's very close to home and I'm seeing her and speaking to her every day, that it's making me concerned about ovarian cancer, other types of cancer, just all sorts, really. I appreciate that this is probably so stupid, but when I push in my ribs here, I feel like I'm pushing something back. Whether it feels like, I don't know if it feels like a gland or I don't think it's a lump, and I feel like it's always been there. Like it could have been there 10 years ago, but it never would have worried me, never thought anything of it. But now, because my mind is just like in overdrive, it's kind of was nothing, and now it's something, and I almost just need to come and speak to someone, and just so I can.
Sounds like you did need to.
Yeah.
So let's feel your tummy and see what there is. Sorry, hands are cold. So actually, show me where you felt at the top.
Here.
Yeah.
So actually, if I'm lying down now, I actually can't feel anything. But you know what, I just find myself there all day going.
Feeling it.
And now, and then I think, because I think that's, I feel like I can feel something constantly, and I know the minute I'm not thinking about it.
Okay, let's start with this and see. Okay, tell me if you get any pain at all. Okay, so when I did that, not painful anywhere?
No.
Okay, let's get you to stand up. Okay, and then show me where, feel it if you can.
If you put your hand there,
Yeah.
I feel like I can feel something.
Okay, yeah, I can feel that.
And then just a
you
little
think
bit,
it's the
and
same
then-
on this side or something on this side. So the same place?
Yeah.
Okay. That feels like muscle, actually.
That's it.
But, that actually is one of the big muscle groups in your abdomen that we're feeling.
Okay.
As you felt elsewhere, you've got obviously the main big muscle groups which are in the middle.
Yeah.
And there you can clearly feel those in you. But I think that's what we're feeling in this case.
Right.
In terms of organs,
Yeah.
you have the liver here, and I can feel that.
Yeah.
The spleen's kind of at the back, right at the back here.
Yeah.
Then you've got your kind of kidneys there. You can't feel those there. Further at the back.
Yeah.
Your womb would be about here.
Okay.
Bladder and womb kind of all level, and your ovaries will be somewhere like here.
Mm-hmm.
So it's miles away from where we're feeling.
Yeah.
In terms of what you felt, I'm definitely not at all worried.
Right. Okay.
Okay.
That's as I said,
Yes,
my
no,
friend didn't have anything like
fully
that at all, and
understandable.
she's the same age as me, and it's completely come out of the blue, and it just makes you question everything, I think.
Yes.
But yeah,
How did she find out then? What happened?
So she said in the morning she'd lie down, she'd press her.
Oh, and she felt something.
And she felt a lump. And so she was just like, I really should just go and check this out and just put her mind at rest. And then fast forward 2 months, she's had a full hysterectomy, cervix, ovaries, everything out. Luckily, she's already had her kids. But now she's just recovering from that operation. She kept saying, you know, like, as long as, you know, if anything comes out of this, if you're worried about anything, you just go and get it checked out. And which is why I came, really, just to sort of, I'm sure I'm probably being stupid, but...
No, but as you said, it's worth checking out. It's worth checking out. And something you don't know what it is, it's worth checking.
Yeah.
So in this case, it's fine.
Great.
But if you do find anything else, do come back.
Wonderful. Okay.
All right.
Thanks very much.
Right. Bye-bye.
Bye.
See you.
It's like musical rooms out here, boy.
They've all just shuffled around, so they're in different rooms, but we're aware of where they are and stuff, so it's fine.
Come in. Hello. You all right?
Up there, around here, and yeah.
Oh, no, the room. I get moved around a lot.
Yes.
It's very unpredictable. So, in terms of your blood results, we've been trying to decide whether or not you needed to go and see somebody about this tummy pain.
Yeah.
Over a number of appointments, Leslie and I had discussed his abdominal pain, his diet and his lifestyle.
I buy some, what they call, not chicken nuggets. I eat, like, say, 30 of them in one go.
That's quite a lot. The last set of blood results was completely normal. And I think, actually, you probably don't need to go and see somebody about your tummy pain unless it's bothering you.
Unless the blood tests come back a bit.
No, the blood tests are normal. Because we've talked about your diet quite a bit and the fact that it can be very erratic. I think that you can get some tummy pain if you're not eating a regular and healthy diet.
That's right, yeah. And that's why I go to these nutrition classes. So I've been to a couple and, you know, you learn a lot. Initially, you walk out the building thinking, oh yeah, next time I get money, I'll go and buy some of this, some of that, some of this, some of that. Because when I get the money, it goes on what I normally buy. I think to myself, well, I should really buy a whole bunch of salad.
Yeah.
And, you know, just eat like a rabbit for a week or a couple of days. You know, that's what you call it, rabbit food.
Rabbit food. I didn't know you were going to nutrition classes.
Yeah, we had one in the house. And,
what kind of house is it that you live in?
It's like a hostel. I was offered a place 2 years ago and I didn't take it.
Okay.
Because of their rules.
Yes.
Their rules being you can't have a beer.
No.
And it's not so much that, you can't have a beer outside. So I'll give that the elbow. But this place here, they don't say you can drink, but if you do drink in the house, just drink in your room.
Leslie and I have talked about his alcohol consumption. I'd really like to work with Leslie to try and help him to eat a healthy diet and to try and reduce his alcohol consumption. So let's conclude. Your tummy pain, you've had it for 20 years.
Right, yeah.
It's not too bad. We know your diet's very erratic, and you've told me nothing like a swallowing problem or bleeding or weight loss, which makes me worried.
Okay.
Okay?
Yeah.
Lovely. Good to see you again.
Yeah.
So come and let me know if this tummy pain is worsening, and then we can do a referral.
Yeah, okay.
All right?
Yeah. I'll see you in there.
Yeah.
Okay.
Bye.
Where's the sandwich list?
Egg and cress.
No, I don't want egg and cress.
I don't know, something like chicken, like, I don't know, New York.
Tuna and spring onion.
Tuna?
And spring onion. You only do tuna and spring onion, isn't it?
Never had that one before, but spring onion is quite nice.
Hi, Mark.
Hey.
I'm okay. How are you?
Yeah, right, not bad, thanks. Yeah.
Yeah?
Okay, yeah.
Okay.
Yeah, well, I had my first CBT appointment for 8 months, I think, last week. So just sort of tweaked a few things that I was doing.
Okay.
So I'm just going to try and go to bed at 11 every night and cut out all alcohol, which I've been doing last week.
Mark has suffered with anxiety and depression since about
2012, 2013. He'd previously presented to his GP initially with just tiredness, but then he developed more depressive symptoms and was diagnosed with depression.
Also, I've been keeping like a sleep diary and activity diary. And, like a food and exercise journal as well. And just noting on it when I feel tired and how I feel, what thoughts are running through my head and that sort of thing. Feeling a little bit better, but sort of mood sort of up and down still, which seems to be, I don't know, I thought I'd sort of, that had improved before, but it seems to still be sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
Yeah, just feeling quite down and a bit dejected, I suppose, and just, just thoughts about ending it all and how I do it. But, I suppose they're quite occasional still. They're not like regular, but they're still quite sort of, it can last for an hour or two, sort of thing. I'm quite down and not really want to do anything.
Yeah, and that happens a couple of times a week? Or?
Yeah, it's not that regular. It's probably every other day, every few days, maybe something like that.
And what do you think about what you would do, or what your options are?
Yeah, that sometimes. Yeah.
And what have you thought your options are?
Just sort of running away or stabbing myself or something like that.
Okay.
Yeah.
You know what I'm like.
Yes.
I will panic.
You worry if you don't know.
And I'm worried, and I panic, and then I get depressed because I don't know what's going on.
Like if I'm asleep, I quite often wake myself up thinking that I'm kind of choking a little bit.
You're not actually, when you wake up, you're okay.
It's fine, but it's kind of like a panicky kind of thing.
I was going to say, it sounds a bit like a panic attack.
I think you put a bit of weight on since I last saw you, haven't you? Yeah, you used to be a skinny chap.
I did. Well, it's all to do with my inactivity.
Oh dear.
Depression.
Oh dear, I'm sorry to hear that.
I've had a lot of stress over the last couple of weeks because it's the end of our financial year and we've all been scrabbling to try and do our numbers.
Yeah.
I think you're unwell at the moment, and I do genuinely think that you will get better.
Yeah.
I do have that hope.
Yeah.
That you are ill, and I think we are getting you on the right track, and I think all credit to you because you put so much effort into getting better.
Yeah, thank you.
As well,
Yeah.
And I think that you will have a fulfilling life again.
Yeah.
Mark is definitely someone who is doing his utmost to help himself, and when patients are really trying to help themselves, it does make our job much more easier, and they tend to respond better as well. Unfortunately, part of the problem with depression is that you sometimes lack that motivation and that drive.
Are you still seeing the psychiatrist?
Yes, but I haven't seen him for about a month.
Okay, so there's that to do. I know we've got to sort your medication.
I just need some more. But I don't know if I need a higher dosage on the sertraline.
In terms of safety, in terms of those suicidal thoughts, like if they get more common or you're taking them that bit further, then please let me know, let anyone here know.
Okay.
Go to A&E, because that's part of the illness, okay? And we won't want you to do anything when you're not, well.
Yes, sure.
That has such serious consequences.
Yeah. Okay.
Yeah. Should we put a review on?
Yeah.
Just do 4 weeks, because you'll have seen the psychiatrist by then, and
yes,
it'd be nice to know how the chronic fatigue referral is going through.
Yes, sure.
Okay? All right.
Thanks so much.
See ya.
Bye.
Nothing for today, I'm afraid. Oh, actually, I've got a 4:30. That'll be with Dr. Pierce. Yeah. What's the date of birth?
What was the appointment for today?
It's itching. I'm getting these marks around this area. It's mainly upper body and around neck as well.
Okay, let's have a look at the rash a little bit more.
You want to take off?
Yeah, if we lift this up, see where the main bit of rash is. Okay, it's quite noticeable, isn't it? Do they come up as little pustules or?
No, it's the same, but it's very irritating, you know.
Yeah. Okay. And do you share a bed with anybody at home?
No.
Okay. How long have you had the rash for?
This is, I think, about 4 or 5 days, this front side.
And it's very itchy?
Yeah, but the back one, you know, because I can't see it. So...
The back's where it started off, though?
But I think it's not much now, probably.
Yeah, it's not a very specific one, but has been itchy on there.
Yeah, but it's a long time. But the last few days, it's just mainly here, and then yesterday I had a very bad towards the neck. It was like here.
Just very itchy around there. And what do you do work-wise?
I'm an accountant.
I'm an accountant, so not exposed to anything
No.
doing accountancy.
No.
I wonder, just looking at the rash, whether or not it could be a type of rash called scabies, which is caused by a little mite that lives on the skin. It's the sort of thing that you can pick up, sort of sleeping in a hotel bed or anything like that, where somebody else...
It's the same bed I'm sleeping, and it's not being shared with anyone.
Scabies is the name that's given to a condition where the skin is infested with a small mite that lives just under the skin surface. Some of the myths associated with scabies may be that it's a disease that dirty people have, but in actual fact, it's something that we can pick up at any time. This will be something that they would have come into contact with a number of weeks before, maybe really anything up to 6 to 8 weeks before the itching has started.
And yesterday I requested the antifungal cream for because I feel smell down the bottom between legs and armpit.
Let's have a look at the armpits as well. Let's have because we might just try a tablet from a fungal point of view. Okay. And in there, so it's very itchy around here. Yeah, it could be. It's not very classical of intertrigo. And a similar thing in the top of the groin.
Yeah, here. It's not itchy,
Yeah.
but it's a smell.
The antifungal cream tends to improve that, does it?
Yeah. Because it's after a long time I'm having it, because it's worked really good.
Well, let's try a slightly different approach to it, and we'll go down the route of a medication, like a tablet form of the cream. The areas where this is happening, whether or not there is a fungal component to it, it's difficult to know. But we'll see what happens with this rash over the next 2 weeks. Okay.
Thank you very much.
Take care. Take care.
What we can do for you is we can either book the next appointment, which will be next week, or if you don't feel able to wait till then, I can get an on-call doctor to call you today. Are you available to take a call today?
Come in.
Right. Well, it started Monday. I've got an abscess or a boil in my mouth. Can you see where it's swollen?
I can, yeah.
Right. Do you want me to open it up?
Well, when did it start?
Sunday night. Yeah, I didn't think it was. I think it's there on my gum. Can you see it?
Yeah. Let me just wash my hands.
Well, I just washed mine before I came out, but yours are probably cleaner. But I can't figure out why it's affecting my cheek.
So, what did you notice, first of all?
Monday I woke up and I went, oh, stop with that. Because I wear a little plate, and it's near where the plate is, but I don't think that's doing it.
When did you notice the swelling of the
this
cheek?
morning. I didn't even, I got up, I had a quick wash in that. I'm going to I need a bath tonight. But I washed like that, I was in a hurry, I went like that, took those bits off as you do. Once a week, shave tonight.
Yeah.
And I got somebody went, what's up with your face? I went, what do you mean? I said, well, there's a big swelling in the right hand side.
Let's have a look then, so. Can you put your tongue on the top of your mouth like
I can
that?
do that.
Not quite, just at the front of your mouth, so like that. Okay, fine. And then just relax. Okay?
Okay.
And does this, I'm just going to press on you. Does that hurt?
Not in the cheek.
Yeah.
Where is it? You can press the bit that you think it is.
Tell you what, just, can you lift that up? That's
How's
great.
that?
Oh, it's a nasty infection, isn't it?
Oh, well, I don't know how I got it. Brush my teeth and all that.
Can you do me a favour? Can you get both of your hands
And what both
lift
left,
it?
right? Hold
Yeah.
on, hold on. But how's that?
Yeah. That's great. Okay, fine. When did you last go to the dentist?
So that was 2 months ago. I'd never have any trouble with the
so you
dentist.
went 2 months ago?
Yeah, they put it in. I'm due for another checkup.
Did you smoke?
No, I stopped. I'm stopping. I've seen Mr. Passois at the moment since last September.
How many years did you smoke for?
A lot of years. Since about 16 or 17 years.
So 45-ish years.
But I've been chewing a lot of gum, but that wouldn't do it, would it?
No. What about alcohol?
I've cut back down on that and all.
Have you ever drank in excess?
Maybe years ago. That stopped in the last couple of years, pal.
Okay.
Sorry.
Okay, that's fine. That's okay.
Aye, maybe I've done something that
I think
I
the most likely thing is an infection. I agree, it's a bit unusual.
Gloves off, and sometimes you go like that if you're sweating on site. You know.
So what I'm going to give you some antibiotics to treat the infection. Probably be a good idea to try and see a dentist as well.
Right.
Okay. I'm going to give you some mouthwash.
Right.
As well.
Okay.
To use just to keep it all clean. So you're going to take some ibuprofen 3 times a day with food.
Yeah.
So that's for pain and swelling. If you're still in pain, you can take paracetamol on top of that.
Going to be high as a kite.
In a couple of weeks, if there's any problem at all with your gum, you need to come back. Because in people who've been heavy smokers, especially if you've been drinking as drinkers as well, we always need to make sure that everything heals up properly. Because if it's not, sometimes it can be a sign of something nasty like mouth cancer. Okay? All right.
Thanks very much for your
All
help,
right.
Doctor.
Pleasure.
San? I'm saying it wrong, isn't it?
Shan.
Shan?
Yeah.
Shan. Right, Shan.
All right.
Thank you very much.
Bye.
Aaron speaking, how can I help?
Have you brought a urine sample in today?
No, I didn't. One of the tests is a stool sample. Okay. So you'll need to drop that off for us if you don't mind.
Are you able to provide one quickly now?
Touch and go, I can try.
I've brought a sample because I hope I'm pregnant.
Okay.
Yeah.
Good.
Don't know if you need that.
I don't actually,
Okay.
but it's good to bring it. We don't tend to repeat them here, but I'll ask some questions. The tests that we do here are exactly the same as the ones you buy over the counter. So, when was your last period? As the first question.
29th of
What do you
June.
mean? June. Okay. And your periods are normally quite regular, are they?
Well, they are, apart from, I don't know if you've seen, but I've had 2 miscarriages and one was recent, so I actually haven't had a period since the
then.
last one.
So that period you're saying on the 29th of June was...
Yeah, the miscarriage.
Miscarriage, okay. Yeah, I'm sorry to hear. I saw that. I didn't realise you'd had one before as well. When was the previous miscarriage you had?
It was April.
April. Okay. And were both of them early in the pregnancy, or...?
The first one was about 8 or 9 weeks.
Okay.
And then the last one was like 6.5, 7 weeks. So.
Okay. So you must be very pleased you're pregnant and also
No, I'm
quite worried.
absolutely terrified.
Are you terrified?
Absolutely terrified.
Miscarriage is quite common in early pregnancy, particularly in the first trimester, which is the first 12 weeks of pregnancy. Clearly, it's always very upsetting whenever a miscarriage does happen, and it's understandable at her reaction of being very worried about this new subsequent pregnancy. However, having one miscarriage does not significantly increase the risk of having a future miscarriage.
Any little twinge, I'm like, ugh.
And what happened last time? Did you have some bleeding or pain, or how did it come to light?
So the first one, yeah, pain and cramps. Well, the first one started with sort of a little bit of brown discharge, and you know, you convince yourself that that's okay because it could just be old blood, etc. And then, but I did sort of have period pains, and the second one was earlier, and it was the same sort of thing.
What a hard year you've had. That's...
Oh, I know.
No, not good. Okay.
I saw it this morning.
I know you did.
Well, what with my foot and how I feel, I don't feel good at all. That's why I left a message this morning that I thought I had some more steroids, but I haven't. So that's what I need, I think. It's been a job to breathe. Breathe through my mouth, not through my nose. It's been blocked up.
Your nose has?
Well, I keep blowing it, you know. But
Okay. And how long have you been having difficulty breathing for now?
A couple of days.
A couple of days?
Yeah.
Okay. You seem more breathless than normal.
Yeah, I am.
Yeah.
I can't do anything without sitting down.
Okay.
All right if I sit for hours. I can't do that.
Can I just check your temperature? And check this side.
I think I've got
No. Have you been managing to look after yourself?
Yes.
Yeah? Can I pop your finger in there?
And my foot is killing me.
Have you got an appointment yet?
I've had it. I phoned them up.
Yeah.
They gave me a boot. Well, that's a joke.
Ah.
I tried wearing it, and what that does, it takes you off the floor that much.
Right.
So your hips ache because you're walking out all out of line. No good. It is very difficult, very soul destroying.
I think the hard thing is I don't think there are any other options really.
Well,
apart
that's what
from
he told me.
painkillers and time. Your oxygen levels are quite low today. They haven't been this low for a while. One option is to go into hospital.
What can they do?
I can't breathe, I can't cope. I wake up 3 times a night and my partner is waking up. It's just getting worse and worse. I can't just breathe because constantly being blocked.
I sort of feel wheezy, you know, sort of that I always need to sort of cough.
Just feels almost like I'm sort of gasping for breath. It feels like I'm just kind of restricted.
Lips tight on the cardboard bit, and then fire the air out fast.
Okay.
So it's a real...
I like your dress.
Thank you. It's new.
Nice. Nice and bright. Nice.
If you sit forwards for me. And just breathe in and out for me.
I had the blood test this morning.
Okay. So obviously your breathing's not so good today. It's quite a lot worse than normal.
Yes, I know, but what I can do.
And your oxygen levels are quite a lot lower than normal as well. One option is to go into hospital. The other option, which is potentially more risky, is to try and look after you, you know, here and at home.
Well, if I could have another go here at home.
Okay.
The benefits of staying at home compared to going into hospital is that there's less waiting around. It tends to be a less stressful environment for their recovery. Also, they tend to sleep better as it's less noisy. And also there's a reduced risk of infection. If we felt it was safe for somebody to stay at home, we would always try and keep them at home. But obviously we need to take their wishes into consideration as well.
If you tell me exactly what I've got to do,
yeah, okay,
then I'll do it.
Yeah, I'll ask the respiratory nurses to come and visit you tomorrow.
Yes.
Okay, but if you have any problems, call the surgery as well.
Okay.
Yeah, because we can
What
help.
such as problems?
Look, if your breathing's getting worse or you
Yeah.
can't manage at home.
Yeah, well, I would tell you.
Yeah? Okay.
Thanks a lot.
All right.
Yeah.
Pleasure.
Thanks very much.
I'm seeing you next week, aren't
It
I?
was raining when I came.
Looks
I
like
had
it's
it back
stopped
on.
now.
I think it's all right. Thanks, Doctor.
All right. Bye.
Thank you.
Other way.
What may be worth doing, given your history, is getting you an early scan in the pregnancy.
Yeah,
so
that would
we
be
can
good.
check everything's going okay.
Yeah, that was one of the things I wanted to talk about, and then just if there's anything that I can do. Obviously, I'm willing to just try. I've stopped running, which probably I don't know if it's a good thing or a bad thing. I'm really trying to do everything I can, so at least then I can say to myself, with nothing I've done.
Yeah, and I think that's normal to do that, and I think that's probably an appropriate thing to do. There isn't any evidence that running in any way will affect or doing sport will affect it, but human nature being what it is, it's not. If that's a decision made, that's fine to do that. Yeah. To be honest, whether it makes it better or worse, it's mostly out of your control because it's more to do with the DNA of the embryo that's forming rather than anything that you were doing. I think it's really, really hard when you've had such a difficult year. I think the best thing we could probably do is figure out your dates now and try and get you a scan in about 7 weeks so we can see, and there's an early pregnancy unit at St George's.
So what will they be able to see at this early stage?
And hopefully at 7 weeks you should be able to see your heartbeat, you should be able to see the gestational sac in the womb, and if they can't, what they would do is then bring you back the following week so they could scan you again.
Okay.
All right.
Cool.
Okay.
All right.
Do you want me to dispose of this?
Yeah.
Yeah, I don't really want to carry around.
Lovely.
Okay, well, I hope it all goes well next week.
Yes,
Okay.
I'll let you know.
Good.
Thanks very
All right. Bye.
I'm not too sure. Bear with me a moment. Is ear syringing messy?
Messy?
Can it get messy? Yeah.
No, they won't get messy.
No, it won't get messy, no. All right then, okay. Bye.
So have you had your ears syringed before? No. Irrigated or anything, no? It's not a painful procedure, it's just feels a bit weird, warm water in your ear.
Okay. Yeah.
Just come and take a seat over here. Thanks. So if it does start to hurt, because it's not supposed to, then let me know and I'll stop. I'll put this here, don't get wet. Hold this cup under your ear like that for me. Look straight ahead. Keep your head just like that. Like that, straight ahead.
Yeah, cool.
You ready?
Yeah. Oh, wow. Feels alright, actually. Whoa.
There it is. Quite little lumps come out.
Oh my days.
What?
Oh my days. That sounds bizarre.
How does it feel?
I can hear you. You sound like you're shouting.
Have a look in the cup if you want. Does it feel good then?
It feels amazing.
There you go. Let me have a look in quick.
Oh my God.
That's the best reaction I've had.
I'm gonna listen to some music tonight.
Yeah, enjoy. All right, let me just move you around here just a little bit. That's it, and then that. All right. And just look straight.
Yeah.
I'm gonna begin, yeah?
Yeah.
There we go. Wow. Wowee. That was even bigger.
Seriously?
Have a look.
Oh my goodness. Oh my God.
What? The hearing?
Oh my goodness.
It's weird, isn't it? Let me have a look.
That is amazing.
Let me just look.
You don't value
Your hearing
until it gets taken away from you, like from the guts or something.
You see the big lumps in there?
I see.
Mm.
It feels weird. I can hear myself inside.
Right, there you go. 2 crystal clear ears. Oh, sorry.
Oh my goodness. I'm meant to feel like this. I can hear myself inside.
Because you're not used to having their normal hearing. They've been blocked up God knows how long.
Yeah.
So this is how sound should usually be.
Okay. Oh my goodness.
There you go. Happy?
Yeah. I'm more than happy.
Good. There you go. All right. Take care. If ever you need it done, again, you know what to do. Take care.
All right, nice to see you, Barbara. Bye.
Nice to see you. Okay. Take care. Bye-bye.
All right.
Love to see you.
That's okay. Thank you.
Okay, I love you. Thanks for seeing me.
No problem.
Yeah, thanks a lot.
Take care.
Clearly your hearing is affected.
Because I've come here because I need to talk about it. It's just too much.
Way too much.
What happened to you?
I was stabbed in the head.
Oh, God.
Yeah.
Oh, my God.